Welcome to the educational series by Prospera Global on medical second opinion driving clinical accuracy and cost optimization. Question 5. If I may ask a related question regarding the patient's symptoms and treatment duration, in many surgical approval cases, it is mentioned that the patient has been undergoing conservative treatment for around 6 months without significant relief. In your opinion, is 6 months generally considered an adequate duration to conclude that conservative management has failed and that the patient may now be considered for surgery?
Yes, if that is the scenario, it is better to see whether he has really consumed those conservative management options in terms of medications, whether he has purchased them, he has taken them, or he has opted for any other thing that we need to be making sure, like clinical history. Or is the symptoms worsening in the last 6 months? So that's also a factor which needs to be. The pain cannot be the same for 6 months. Either it should decrease or it should increase. So whether he has received the treatment or not, one concern is always we need to put a point on that. So next thing is there is an over reliance on the imaging things. So as I said, in clinical examination, compared to what we have been taught, they are supposed to be the prime driving things for a surgical indications. So otherwise, most of the time the MRI diagnosis will be over, like either it is on the higher side compared to the existing clinical scenario, because either the MRI MRI reporting doctor may not have been given him proper details about the clinical scenario of the patient, what is his radiculopathy or what is his weakness in his limbs. So if those things are not given to the MRI people, they always try to put everything. L1, L2 is also having a disc bulge, L3, L4 is also. So it becomes kind of this one. So we won't be able to treat them within really this one. So sometimes when there is multi-level disc problems are there, the obviously a newcomer or an over enthusiastic surgeon may always opt to fix them the entire level, which will increase definitely the surgical cost as well as burden to the patient. So that's one of the things that I come across, over reliance on the imaging. Another thing is, in the present world, with the present competition levels, the importance of conservative care is never given to the patient. So that's one thing. And patient counseling and decision. So definitely sometimes they scare the patient. So these things also are there. Having said this, as an spine doctor, I do somewhere around 400 surgeries a year. So most of the time I treat them, I convince them not to go for surgery and tell them opt for a conservative management for some time. Anyway, we are not losing anything with epidural steroid or trigger point injections. And then if they really come back to me after certain days, so then I operate. So that's one thing that really is helping the present population. So they bring more patients to me with that, because the doctor was not eager to operate on me. So that's how it is. Another thing on the contrary to that, so if I have said a minor disc bulge in an young lady who is 35-year-old who can be treated conservatively, and some of the patients will be restless, so they want an immediate quick relief from that. So they go to another doctor, they get the surgeries done. I feel surprised with that behavior of the patient side also. So in the present day, there are problems related to the MRI, the problems related to the over-diagnosis, or the problems related to the quick relief from the patient side also. So where the doctor will be in a confusion whether to opt for a surgical management or a conservative management. The moment you see or convince a patient for a conservative management, you are being in the present world, some of the patients, they look you down as you may not be confident in treating me or giving me an quick relief. So that's also one thing that we come across. So the third question that you are telling was about how the cost can be reduced. Definitely whenever we treat patients, we definitely end up when they are treated conservatively, the cost will be usually reduced. So definitely, I will be more dependent on clinical scenario, whether the previous doctor has given me or concluded, or whether I can concur whatever his findings he has been written, or whether he has not mentioned, or whether the MRI is overly relying on small disc bulges. Okay, so these are the things. Okay, and also the patient factors, from how long they have been. Okay, so a patient who's been visiting me for past 3 months definitely is a candidate for surgery. I do put some red flags. Okay, so whenever I convince them for surgery, for the insurance company, I give the details of all my 3 previous consultations, what was given and what the patient has come for. So those previous things, if they are proper, I should feel the patient should be eligible to go for the surgery.
We hope this insightful session has enhanced your understanding of medical second opinions and addressed any doubts you may have had. Thank you for being part of our Medical Second Opinion educational series. If you found this helpful, please like, share, and subscribe.